we have with us Dr. Dhritabrata, who will be presenting his paper on Pediatric Cardiology.
Respected chairpersons and my colleagues, I will be speaking on cerebral palsy and congenital heart disease. Now, by this time, I think we all know what is cerebral palsy, and I'm not going to elaborate it anymore. But what is my point of interest, how congenital heart disease is related to this particular problem? And at the same time, when we are discussing cerebral palsy, I would not like to ignore the wider spectrum of the disease, which is the other neurodevelopmental problems. The brain damage that leads to cerebral palsy can also lead to other health issues. What are these issues? Visual disturbance, hearing problems, speech problems, and learning disabilities. Often in patients with cerebral palsy, we find a combination of all these problems. So motor disability along with learning disability, speech problems, hearing issues, but there may be isolated learning difficulty at the other spectrum of the disease. Now, while we have already listened about the causes of cerebral palsy, there has been a change in the concept, and now we think, according to our present knowledge, that mostly it is a prenatal problem, so it is not related to birth asphyxia alone. About the prenatal causes, what Dr. Arijit Chattopadhyay has already discussed in details, the genetic causes contribute a lot. The chromosomal problems and different mutations can cause cerebral palsy. And another important factor is the intrauterine infection like congenital rubella, toxoplasmosis, or cytomegalovirus, which can affect the developing brain. Now, how is congenital heart disease placed in the whole scenario? If we think about the genetic causes, most of the chromosomal problems and the genetic mutations affect the brain as well as the other systems. And cardiovascular system is one of the main problems in case of cerebral palsy. If we think about Down syndrome, Dye-George, Williams syndrome, these all are related to congenital heart disease and a varied amount of neurodevelopmental problems. And congenital heart disease itself is as important cause of cerebral palsy. This is very interesting. If we think about congenital heart disease, it is not that it is a heart problem. It can lead to a different kind of systemic problems, and the developmental issues is a main concern. I will elaborate this in detail. Let us look at this particular article, Impact of Congenital Heart Disease on Brain Development and Neurodevelopmental Outcome. This was published from the Children's National Heart Institute in Washington. And if we look at the details of the paper, it tells us that although there has been a significant improvement in the cardiac surgical techniques and postoperative care, almost 50% of the surviving children who has undergone a cardiac surgery will have neurodevelopmental outcome across a wide spectrum, and definitely cerebral palsy is at the extreme. What causes this problem? Now, preoperative brain injury, it is not that the surgery itself is the culprit. Those babies who have congenital heart disease, the preoperative investigation reveals that their brain is often already affected. What is the reason? Now, the main reason what is being thought of is the intrauterine hemodynamic alteration. Especially if we think about the congenital heart problems, the cyanotic heart problems, they have less oxygen in the blood. And a developing brain, when they are exposed to less oxygen supply, less perfusion, this can lead to a permanent brain damage. There is abnormal brain development, congenital brain abnormalities as well, and acquired brain injury that I have already discussed postnatally also. A baby who is cyanotic has a less saturation, so a developing brain in the first few years of life, if they get less oxygen, there is a chance of having a developmental problem in the brain. And it is well described that there is a high incidence of brain malformation in babies who has congenital heart disease, even in the absence of a defined genetic syndrome. And these brain findings may be due to undefined genetic abnormalities or may relate to alteration in the circulation leading to injury. So there are two factors: the particular gene mutation, which affects the area of the gene which controls both the development of the brain as well as the development of the heart. And that can explain that why they are related quite often. And similarly, in case of congenital heart disease, they have altered hemodynamics. Their blood circulation is different from a normal person. So let us look at the picture. The first one describes the normal circulation of blood. But if you look at the second and the third one, where there is a hypoplastic left heart syndrome, hypoplastic right heart syndrome, tetralogy of Fallot, transposition of great arteries, all these are cyanotic heart problems, and the blood which is reaching the brain has less oxygen. So this is probably the only or the primary factor for developmental brain abnormalities. And we cannot ignore the operative complications as well. Since the beginning of the cardiac surgery, the cardiopulmonary bypass itself has been a major problem with the brain development, because during the cardiopulmonary bypass, the perfusion is being controlled by the machine, and the cerebral hypoperfusion is a known complication and has long been attributed to a neurological outcome in the post-cardiac surgery cases. The most problems happen in the case of single ventricle physiologies, where there are multiple surgeries and they are cyanotic, and there are hemodynamic alteration can affect the brain a lot. Now, when we understand the causes of cerebral palsy and the congenital heart disease, we can move on to the treatment part. Definitely, there are two parts of any treatment strategy. One is the prevention and another is the cure. And this proverb cannot be more true in case of cerebral palsy, because we don't have a cure. Now, what can we do to prevent the genetic causes? Now, most of the genetic causes are still unknown. A lot of research is going on. As far as I remember, about 6 mutations have already been identified for cerebral palsy. And this early detection of the high-risk cases is very important. So even if we don't know the genetic mutation, we can definitely look at the different chromosomal abnormalities which can be detected by the antenatal investigation, which Dr. Khastagir has already discussed. And about the imaging, the nuchal translucency scan, the anomaly scan or the anatomy scan, fetal echocardiography play a very important role to detect such anomalies. If you look at this fetal ultrasound, the nuchal translucency, if it is increased, it is very predictive of abnormal chromosomes or a congenital heart problem. If you look at these brain ultrasounds, anyone can appreciate that the ventricles are significantly dilated. So you know that if this baby is delivered, he will have a major neurological handicap. So fetal echocardiography, as Dr. Khastagir has already discussed, that we should probably screen all the babies, especially those under the high-risk category, with all the antenatal investigation and the imaging. Fetal echocardiography, I have just mentioned a few indications. So wherever indicated, we should do a fetal echocardiography to find out major congenital heart problems. And unfortunately, the awareness about all this antenatal investigation is still quite low, even in the cities. If we think about the fetal echocardiography, this is a fetal echocardiography of a hypoplastic left heart. And if you look at this picture, this is, the left ventricle is small. You compare with the normal 4-chamber view in the left lower panel. And if you look at the top right, there are two parallel red, which are the two ventricular inflows. But if you look at the lower one, there is only one inflow. So the left-sided inflow is absent. So this is a mitral atresia with hypoplastic left heart syndrome. And definitely we can detect such a major cardiac problem in the early stage of pregnancy. We can think of terminating and prevent a major handicap. Another very sad story is the intrauterine infections. Congenital rubella syndrome we still are seeing. This is really unfortunate, because just a simple shot of rubella vaccine can prevent it. But the awareness about the rubella vaccination in the women of childbearing age is very low. We are very concerned about the immunization in the babies, but we don't think about the immunization in the adults. So just a single shot before a woman becomes sexually active can prevent this, the catastrophe of a congenital rubella syndrome, which affects the brain as well as the heart, eyes, and the ears, and can be really devastating to the family. About the treatment, definitely early detection and proper evaluation of the problem is very necessary, especially the cyanotic babies. We need to maintain a proper oxygenation of the whole body to give them a better life. And another interesting area is the non-surgical techniques. The surgical, the cardiopulmonary bypass can be avoided with the advances in the medical science. And I'll just present one or two cases how we can avoid the cardiac surgery to treat congenital heart disease. This is a 1.5-year-old boy from Bangladesh with a spastic cerebral palsy who was admitted twice there with pneumonia. We know that there are many causes of pneumonia in cerebral palsy, but definitely a PDA which increases the blood flow in the lungs will cause a more problem in such a scenario. So at least we can treat the PDA and we can give the child a better life. If we look at the pictures here, so if you look at this picture, this is the PDA device which is here, you can see. And when we are injecting into the aorta, there is no dye. So the main beauty of this non-surgical intervention that we can avoid cardiopulmonary bypass, and most of this procedure can be done under conscious sedation, so we don't need a general anesthesia. This is another PDA device closer in a congenital rubella syndrome. This was an unfortunate child who was 5-year-old, lovely young girl, and who had a large PDA with severe pulmonary hypertension, but she also had bilateral cataract. But unfortunately, the surgeons were not willing to operate on the cataract because of the underlying heart problem. So what I did, that if you look at these pictures, so you can see that I am injecting in the aorta, and the dye is going into the pulmonary artery. And if you look at the pulmonary artery which is in the front, that is almost 3 times of the size of the aorta. And this is from the same injection from a different view. So this is the connection between the aorta and the pulmonary artery, which is the PDA. So how we close it? Now we can close it without surgery. So what we do, that we take a device and we place the device. I am not going into the details of the technique. We place the device within the PDA, and that completely closes the PDA. And this is done under a conscious sedation, and we can avoid the cardiopulmonary bypass and its complications. And if you compare the picture before the closure and after the closure, you will appreciate the difference. So what are the congenital heart diseases which can be treated with surgery? There is a few list, but there is a lot more. And as a take-home message, I would like to stress upon that we can't cure cerebral palsy, but we can prevent many of them. Associated congenital heart disease is not uncommon, and antenatal diagnosis of major anomalies should improve and prevent the complications in the later life. And treatment of associated problems like congenital heart disease will help them to lead a better quality of life. And at last, I would definitely like to thank Bishwa Bandhan Foundation for creating a better world and a safer society. Thank you very much for a patient hearing.